Bayan, have any of our local hospitals increased their nurse to patient ratios yet?
Well, here's what we know so far. I did speak to a few of our local hospitals, and they told me that they have not officially made a decision to change that nurse to patient ratio, but they said that with a shrinking ICU capacity in Kern County, changing that ratio is something they're certainly considering.
As an ICU nurse, I can tell you that short staffing is the difference between life and death.
Everyone's calling us heroes, but we have lawmakers that are strictly throwing us under the bus.
Several ICU nurses across California expressing their frustration during a California Nursing Association press conference Wednesday. The issue, one of Governor Gavin Newsom's latest executive orders adjusted the nurse to patient ratio from 1 nurse per 2 patients to 1 nurse per 3 patients.
ICU patients are the sickest people in the hospital.
John Pasha is a cardiac ICU nurse in San Jose. He says the move ultimately puts patients in danger.
That's an increase of 50% in our workload, which leads up to 25% worse patient outcomes and 23% higher likelihood of job burnout. And this is according to the Journal of the American Medical Association.
In Kern County, a shortage of nurses has been apparent since the beginning of the pandemic. A second surge, a shrinking ICU capacity. Now, some local hospitals are considering adjusting the nurse ratio as well.
The state will allow us to do that without getting permission right away, which is what we may need to do, but that is not our plan for both Mercy or Memorial Hospital. However, we will do what we need to do to take care of patients.
Kern Medical CEO Russell Judd holds a similar stance as they no longer have ICU capacity and are beginning to place patients in their overflow areas. During the summer surge, hiring dozens of traveling and registry nurses to help out west was critical. But this time around, the surge is more widespread in the country, and now those nurses are unable to come back, according to Judd. He says adjusting nurse ratios at his hospital is also an option.
We're evaluating that right now. Our goal first and foremost is to provide the best care that we can. And clearly the more nurses you have to assign to patients, the better it is. However, we do have to care for patients. So we are evaluating it. I do anticipate that we will take advantage of that flex.
So as you heard there, kind of the same theme from both of those major hospitals. They know the best safety practices is to keep a nurse to patient ratio of 1 to 2, but they're both saying, as you heard, if this pandemic gets worse, they may not have a choice to change that ratio. Now, we also did reach out to Adventist Health Bakersfield. So far, no response from them. We're live in East Bakersfield. Bayan Wang, 23 ABC, connecting you.